Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome back to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And that's why we're honored to have with us Brandi Jack, Chief Operating Officer with Nashville Diaper Connection. How are you doing?
I'm doing great. So happy to be here.
Well, you all do a lot of good, and we'll talk about your programs, your impact, how the community can get involved. But let's start with a little bit of history. Give us some background for the organization.
Absolutely. Nashville Diaper Connection started in 2013 in our founder, Doug Adair's garage. So it came around like many nonprofits. You know, people hear about a need. He was at a church event where a need was being discussed. Multiple needs are being discussed. Diapers was one of them. And he kind of just picked it up and ran. For better or worse, I don't think he knew what he was getting into in the beginning. And so the first year of him running a diaper bank was running it out of his garage, and he distributed about 18,000 diapers into the community. Where prior to there was not diapers available for families. So that was a huge achievement for him. And we have just grown and grown since. It was a nice steady growth until about 2020. And we all know all the stories of 2020. So I will bury you a lot of those details. The need was there before 2020. The difference was we got some funding. We were able to get staff, and people understood, or people saw more of the need. Not that it wasn't there before, but people were really seeing that there was more needs. And so that, helped us in being able to fund some programming and get some balls rolling. So in 2019, Nashville Diaper Connection had 2 employees, and we distributed 800-some thousand diapers. Not quite a million, still a whole lot of diapers, especially for 2 people. In 2020, our staff doubled. We had 2, and that's when I came in, was early 2020. So we had 2 full-time and 2 part-time employees. And that year we distributed 2 million diapers. So huge, yes. And then we've just progressively grown. Our team has grown. So we're able to help more families out there. Today, this year, we're going to distribute about 4 million diapers with a team of 8 people. So super exciting. We have grown out of just Nashville and into Middle Tennessee. So we're in 30 counties right now. So doing a lot with rural assistance as well, which is just so great because there's lots of needs in the rural areas. And so that's kind of been our growth and progression. And so little tiny garage, and now we have a good size warehouse space in the Nations, and we have volunteers coming through there. So we do get a lot of public gets to come and see what we do firsthand. We run about, I think there's about 12 volunteer groups a week that come through. So all of our diapers get processed. We think of ourselves similar to a food bank, because people are more familiar with a food bank than a diaper bank, but we do the same thing. We raise funds to purchase diapers in bulk, and then we repackage everything for distribution through our partner agencies.
As you're already alluding to, massive need, and diapers are expensive. And so when you talk about kind of serving in this gap and what you're seeing and expanding out into the rural areas, talk about why the need is so pervasive, because, for babies, for families, you're talking health and cleanliness. I mean, there's a lot that go into, I think, the power of a diaper.
Absolutely. And that's what we say. It's more than just a diaper. It really is. And for parents that have little ones in diapers, there's a little more that you can relate and you can understand. And a lot of times when you have the funds for them, you don't think about it, right? It's just like buying food, or it's just like buying shampoo. You don't really think about it. But when you think about the fact that diapers run about $100 a month, that's a good chunk of somebody's income. So that's where we've really seen this growth into rural areas where there's not a lot of opportunities. Those wages aren't going up as much as in Nashville. And don't get me wrong, even in Nashville, as wages go up, you still got the cost of living going on. But you have rural areas where those wages aren't going up as well. And so people are struggling, and when families have to make choices of diapers or dinner, right? What am I going to do? We don't want people in that situation is really what it comes down to. And as you alluded to, it's more than diapers along, if we have dry diapers, we have healthy babies. Dirty diapers, wet diapers for prolonged amounts of time, it just leads to problems. It leads to medical visits that are unnecessary. And so that's a big piece of it too. It's a huge stressor for families. I hope you haven't been around a whole lot of screaming, crying babies, but when you are, you think of like how stressful that is. And then you think of these parents, who have the stresses of raising children already. And then you add a screaming, crying baby that you can't soothe. Those are the reasons, that we really do what we do. It's the bigger picture because it's not just a diaper. It's helping families be healthy, helping mental health. The little pieces make the big thing.
Yeah, I mean, you can tell like you've had a chance to see the impact firsthand, right? Like this is an emotional, purpose-driven connection on your, in terms of the impact and what you're doing. And so talk about the programs because you have a number of programs. And so you mentioned kind of the format, the model being a diaper bank, but go ahead and let's start there. So talk about your largest program, your longest program, and then we'll dive into some of the newer ones.
Absolutely. So our initial program is just our community diaper bank. And that's kind of what I talked about when I said, we raise funds to purchase diapers that get repackaged and distributed through a partner network. So we have in that partner network just over 50 community organizations that distribute diapers on our behalf. And one of the bonuses of our partner network is they have other items. It's not just diapers. All Nash Diaper does is diapers. And as important as diapers are, if families need diapers, they definitely have other needs as well. And so these partners have other things to help families with. And sometimes it's tangible goods. Sometimes it's an educational piece, but they're helping families with the multiple needs and the differing needs that they have. So not all of our partners are the same, but they all have something else to offer in addition to diapers. And by using this partner network, like I said, we're going to do 4 million diapers this year. That today we are serving about 6,000 babies a month is what we end up equating that to. I have a staff of 8. There is no way that we are going to have a good connection with those families. There's just too many families for us to service. But by dispersing them among all these community organizations, there's some type of relationship with all of them. Those families get to know the organizations who are giving them diapers and other items, and they get to help find what other needs and what other barriers do they have that maybe they can refer them somewhere else or help them with other needs. That is the community diaper bank at large. That is how we operate. And most diaper banks, that is all they do. That community diaper bank piece is it. Some do direct distribution. It's hard when you get to the scale that we're at to do direct distribution, unless you have a huge team. But that is a community diaper bank. So when you hear about diaper banks, that's usually what they're talking about. We started a couple other programs, which are not as common. Actually, we are the first doing either of these programs, but they're super exciting to us. It's really following things that we believe. And I keep saying, all we have is diapers, all we have is diapers, because really that's all I have. End of the day, all I have is diapers. They are important. I'm not trying to say they're not important, but all I have is diapers. So if all I have is diapers, we look out and we see what other issues would we like to be involved in, right? And so I moved here in 2019. And so I learned a lot of differences in this city. I'm from some larger cities. And one of the things that really surprised me about Nashville was how low our health scores are. Most people are very familiar with maternal health scores in Tennessee, and that we are one of the worst states, which is saddening. What people aren't aware of, what they are not as aware of is that our childhood health scores are really low as well. I believe we're one of the bottom 10 states in childhood health. And that breaks my heart as a parent, just as a person, right? As a community member, it's disheartening. And so we looked at it and said, okay, what can we do to help in the healthcare arena? All I have is diapers. So we partnered with community clinics, low-income clinics, and we put diapers into clinics for preventative health care. I believe that we have to make trade-offs sometimes. Preventative health care a lot of times just doesn't become a priority You know, those regular checkups do not become a priority because my kid's not sick and I don't have time to go. So we tried to kind of incentivize it. Like, I would love to see every family going to those annual checkups. That first year of life, kiddos have like 5, 6 visits that they're supposed to go to. I would love to see families hitting all these, right? And let's take away some of the challenges. So we said, okay, if you go to these appointments, these preventative routine appointments, you get 50 free diapers. So it's kind of incentivizing it. It's giving it, you know, maybe it's a struggle because I have to pay for gas or I have a copay or whatever it is. So let's try to alleviate part of that with 50 diapers at each of those visits. So that is our Connections program, which we started in 21, technically in 20, but that was 2020. So that's super exciting. And we are really proud of that. We have 50 clinics that we work with now throughout Middle Tennessee. So that is super exciting once we got that into some rural areas, because it helped push some diapers into some rural areas as well. And then our newest program started at the end of 21, and that is our Diapers for Diplomas program. And so this one's been getting a little bit of news lately, which is super exciting because we're growing it this year. So our Diapers for Diplomas program puts diapers in, it started in 2021 solely in community colleges. So we put diapers as a scholarship through community colleges. So students can apply. All they had to do was be a parenting student at one of the 4 community colleges. At that time, we were looking at Reconnect families. Most families that are attending and have a young one were eligible. And so we have had, over the last 3 years, about 100 students a year getting that scholarship. So what that scholarship does is you get to order your diapers every month. They get delivered to your college campus and you pick them up there. In this case, you get 200 diapers, which is approximately a full month's worth of diapers. So the idea is we are alleviating a burden for parenting students, right? You're already having to deal with classes and books and all the normal costs of life, plus raising kiddos. So we're going to alleviate one of these things. And so we put diapers in their hands. We put them in the adult learners offices and counseling offices. So that is where the students will go and pick them up every month. And so the added bonus of that is these students are now crossing paths with people who care about their attendance and future and careers, you know, like the whole trajectory of it. So we've been doing that since 2021. We got some funding to double our work, which is super exciting this year. We just closed applications on September 1st, and I want to say we've got about 131 applications. So we'll see what that comes out to once we verify eligibility and verify enrollment. And then we'll open it up again in January to finish filling those 200 spots. So that is super exciting. This year, we also expanded it beyond community colleges to a few TCATs, MTSU, and we're working on getting Austin P for the spring semester.
I love just the innovation around that. And like you said, always looking for ways that we can be a resource, be a catalyst, create, you know, the transformation and the help that is needed out there. And so I love, you know, taking, you know, like you said, it's just a diaper, but it's a powerful diaper, and you can be able to, you know, really help individuals and families, the parents, to be able to step in and help them. And I love that aspect of innovation and entrepreneurship around how can I continually seek opportunities to serve. So carry that into how can the community help get involved with Nashville Diaper Connection?
Absolutely. Absolutely. Well, of course, like I said, you know, funding is always a huge piece of it. You know, I think that's all of us nonprofits. So we're always taking the donations. I like to just go to our website, which is easy peasy, NashvilleDiaperConnection.org. But beyond that, we have a really strong volunteer crew, and we always are having volunteers come in, always looking for volunteers. And that's also partially on our website, or we go through Hands on Nashville for a lot of our volunteer opportunities. We do offsite events, so like a wrapping event. So if an organization or a corporation wants to do a event with their staff, or maybe they have a group coming to town, we can do offsite events like that. Those are great. We do have a minimal charge for those, and that kind of helps us support are going into the community and our time to do that. But it's a huge support for us, while it is great for those companies that have the funding to do that community service. So I'm always really excited when we're getting new companies to come out or to go out and work with new companies in that way. So yeah, really reach out to us too. We're trying to spread the word. We did our first world's largest diaper drive in May, and that was a huge success. It was super fun. So we'll be doing that again next May. The end of this month, we're doing a corporate wrap off, which is a bracketed style competition. That's going to be super exciting, and it's going to be an annual fundraiser moving forward. So we're really excited about that as well. So keep your eyes open, social media and stuff, to see how that goes. And for the people that want to do it next year, it'll be coming again.
Well, you never can say it enough in the world of media. So mention again your website, social media. Where do we go to learn more and get involved and support Nashville Diaper Connection?
Absolutely. So our website is NashvilleDiaperConnection.org, world's longest website. And then you can follow us on social media at Nash Diaper or at Nash Diaper Bank. So everything we do, we try to keep things up to date, things posted. People have questions, you can reach us through there and shoot me all the questions.
Well, Brandi Jack, Chief Operating Officer with Nashville Diaper Connection, thank you for all you and your amazing team do to power the good. Thank you for coming on the show.
Thank you so much. I appreciate it.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.